Okay, hello everyone. My name is James Barker. This is for COH 100. And today I'll be comparing and contrasting Medicaid and Medicare. So I'm just gonna go ahead and jump right into it. Well, I'm gonna be talking about the state of Alaska, and the benefits and the healthcare coverage um, for Medicaid and Medicare. So basically, Medicare, it's a program like within the state. It's around like all the states. So this is not just in Alaska. This is all around the United States. So it covers like hospital insurance, including inpatient care, hospice, and some home health care. Medical insurance, it covers outpatient care, doctor visits, um, and other kind of like medical services. So you can do like private insurance. This is Medicare that we're talking about. And it may cover some kind of like prescriptions and things like that. So this is for anybody who is over the age of 65 or older, or they give this to younger people who have disabilities, and things like that. So Medicaid is more like statewide, so we're going to get into this with Alaska. So it can cover things such as like hospital stays, doctor visits, prescription drugs, mental health services, and etc. And so Medicaid in Alaska actually covers like low income homes, the families, pregnant women, children, elderly individuals as well. And so beneficiaries for people with like Medicare, it probably serves like, 65-year-old people with disabilities or certain conditions. So that's very, beneficiary. And then far as like Medicaid, it covers like low income individuals. So these are people who cannot afford this type of stuff, and it covers their families, and children as well. So, everyone is able to get, that kind of stuff. Um, so Medicare basically is like more nationally, and it just covers some of the states. So Alaska is included in this, and then Medicaid as well. This is more like state wise, and things like that, and it covers um, more like in-state things. There's like many similarities between Medicare and Medicaid. One being how to qualify or being able to get this type of like Medicare. So Medicare is based off like age or the disabilities. Again, Medicaid eligibility is based off like income, so like how much you make. Obviously, you don't want like no one making over 60K. I would even say 55K, because I feel like somebody making 55K can't afford, healthcare, and well, Medicare, my apologies. And then Medicaid, it serves more lower income. So the coverage is something else that I included. Both of the programs, cover like hospice care. Medicare generally covers, less comprehensive outpatient and long-term care versus like Medicaid. Medicaid, with that insurance, it's a wider range, who need the long term care. Um, and then the costs. The costs requires like premiums, deductibles. This is a Medicare and copayments. Medicaid is designed free, and it's lower income, so like they basically pay for that. And so today, we talked about Medicare and Medicaid in Alaska. I gave you like what they mean, some beneficiaries, some differences, and I look forward to sharing, more information with you all next time. It's been a pleasure. Have a good day.